Assalamu alaikum warahmatullah. Now the history of acute glomerulonephritis. The history may be high color urine with reduced urine output. So differential diagnosis may be acute glomerulonephritis, and then Alport syndrome, IgA nephropathy, Henry's colon purpura, SLE, mesopolyphytic glomerulonephritis, and CKD, acute exacerbation. So the history form, just the format. Hello, good morning. This is Dr. Ruxana, one of child doctor here. I'm speaking to Aisha, mom of Arif. Thank you for coming. From GP Note, I came to know that you have concern regarding Arif's health. So I'm here to discuss on this issue. Is it appropriate? And during discussion, I will take some note. Do you mind on it? Okay, thank you. So will you please tell me, mom, what is your main concern? Mom may tell that his passing this amount high color urine. So when you noticed it, does it change over the period of time? Does it occur this the first time or it occurs previously? And at the what phase of maturation do you feel that he has this high color of urine, maturation? And does what's about his pee? Is there any for how frequently he pass pee? Does it painful or not? And then after this urinary history, do you notice any kind of swelling of Arif? From what is the extent of the swelling? Okay, do you notice the amount of the pee? How much amount is nowadays? And then does she has any kind of tummy pain? Any history of upper respiratory infection? Any history of skin infection? And then constitutional symptoms. Do you have any? Does Arif has any kind of fever? Any kind of? What do you have any concern regarding his weight? What about his activity? And now I'm going to ask mom the symptoms of different parts of body to make sure that Arif does has this presentation or not. Such as does Arif complain any kind of a headache, visual problem, weakness in any kind of body, any kinds of feet, and does Arif have any kind of palpitation? Does she complain? Any breathing difficulty? Does anyone ever measure her his blood pressure and the cough? Does she has any kind of he has any kind of cough? Any breathing difficulty? And then what is does she has any kind of tummy pain? Any tummy swelling? Any throwing up? And then does she has any kind of skin lesion? And can you tell me the if it is present, so can you tell me where is the skin rash is present and the distribution, if it is so, is where is the location, does it change over the period of the time, and any factor that increase this rash? And then does he has any kind of joint pain? And after that, if we get, if there is any clue for STD, then we will ask another question for the STD, such as mood swing present or not, any hair change or not. Otherwise, if it's all the, if there is no rash, no joint pain, so no need to ask further about the STD. And do you have any concern regarding his hearing or vision? This is for the Alport syndrome. And after this systemic inquiry, does she has any long extending illness other than this? And any kind of hospitalization? Does she under any kind of team, any kind of surgery? And after that, do you have any concern regarding when he was in your tummy, any the period before and after the delivery? And after this, and after the history, prenatal history, and any, do you have any concern regarding his development, and concern regarding his height, and does she receive all of his jabs, and any allergy to any food or any medication? um, and after this, any family history, how many family members, and any chronic illness or kidney disease or any kind of high blood pressure present in the family or not, such kind of illness in the family or not. After the family history, there is a history of the social history. What do you do for your living? Is it satisfactory? Do you need any kind of extra help? And after this, there is the schooling problem, which grade now he is. And after this, what is the impact of this condition in Arif's life? What is the impact of this condition in and now the presentation, we can follow the situation, background, assessment, and recommendation. So today I took history from Mrs. Aisha, mom of Arif, presented with high color urine and oliguria for last 5 days. On background history, there was a history of upper respiratory tract infection 1 week before, and he has a headache and visual problem and breathing difficulty, and there's family history of no such kind of illness, no skin rash, no joint involvement is present, and mom is worried either it is chronic kidney disease or not. So first of all, and now the differential diagnosis for this case is glomerulonephritis, IgA nephropathy, Alport syndrome, hematoscholin purpura, ACD, messenger proliferative glomerulonephritis, CKD. Investigation for urine investigation, urine parcel, urine RBC cast present or not, and protein creatinine ratio, blood, full blood count, urea electrolytes, serum creatinine, and immunology, serum C3, C4, microbiology, ASO titer, double-strand DNA. And then the management and examination, vital sign in airway, breathing, circulation, neurological examination, people edema present or not, para-abdominal examination, edema, anthropometry, a formal hearing and the vision assessment if required, and para-abdominal examination, cardiovascular system examination, and respiratory system examination. And investigate then management, acute management and long-term management. In acute management, admission, remove of the all nephrotoxic medication, and for if hypervolemia or there is hypertension, so hypertension management and giving injection fusimide, and if there is edema is present, phenylethyl penicillin, and then the discharge from the follow-up, whenever blood pressure is controlled, urine is passing with normal free fluid, and renal function test is normal, potassium is normal, and discharge from follow-up whenever the blood pressure is normal without any anticonvulsant, creatinine is renal function test is normal, electrolytes is normal, and refer to nephrologist whenever there is macroscopic there is massive proteinuria present. The macroscopic proteinuria present more than 2 weeks, macroscopic proteinuria present more than 2 years, serum C3 level is low more than 3 months, and patient has AKI, hypertension, and recurrent family history of nephritic syndrome, recurrent nephritis, positive ANA, anti-double strand DNA, and causes of low C3, C4, low complement level, both ACLE, shunt nephritis, infective endocarditis, messenger proliferative glomerulonephritis, low C3, normal C4. Acute process streptococcal glomerulonephritis, messenger proliferative glomerulonephritis, normal C3, C4, IgA nephropathy, and HSP. Thank you.